My name is Mehta. I'm professor of medicine and physiology at the University of Arkansas for Medical Sciences in Little Rock. My presentation was on reconsideration of the role of statins in primary prevention. And basically, what I feel that the role of statins for secondary prevention is well established in many studies. We saw 20 to 30% reduction in recurrent cardiovascular events and a decrease in total mortality. But when one looks at the meta-analysis of primary prevention trials, that benefit that we saw in secondary prevention is not apparent. Actually, p-values ns are not significant. So one should really seriously consider the use of statins in primary prevention, especially in light of the fact that there is a significant risk that patients who take statins for a long time, especially in high dosages, tend to develop abnormal blood sugar. Actually, in a study that we conducted looking at the large VA database, we found that there is a potential for about 2% of patients taking statins more than 2 years will develop abnormal blood sugar levels in the diabetic range. And patients who already have diabetes, when they take statins or start statins, their blood sugar gets worse. So we did another study to define the mechanism how statins could induce diabetes. As is well known, diabetes may be an inflammatory disease. Now, HMG coenzyme A reductase inhibitors or statins, they affect liver X receptor expression. So we studied liver X receptor expression in mononuclear cells in subjects who received statins. And we found that certain subjects, about 2% to 3% of the subjects, they had certain genotype of LX receptors. And when we gave statins to those individuals, their LX receptor expression actually increased, and those who were heterozygous, in them the CRP levels actually increased when we gave atorvastatin compared to the wild type gene expression in whom CRP levels went down. So in conclusion, we feel that about 2 to 3% of patients may have a LXR SNPs, which makes them pro-inflammatory when statins are given to them. And that may very well be the mechanism how these individuals are likely to develop abnormal blood sugar. So I'm just made here 2 points. One, that statins should not be used just randomly in the primary prevention, because there is a significant risk of developing abnormal blood sugar level. And the benefits are not there in terms of total mortality reduction or reduction in cardiovascular events.